Hi, I'm Jared Hall. I'm here today with my patient that has a spondy, and we're going to go through a home care exercise program with him. So what brings you in to see us today, Peyton?
I came in because Dr. Wagner told me to come to you because I've got a spondy and I was trying to get some home exercises that I could use for a weight program at school and just for stretching in general.
Okay, so he wants you to come in and get a nice rehab program, things that we can do at home. Okay, I've got some things that we can do for you. First of all, I'd like to talk about some short-term goals and long-term goals. Do you know what those are?
Yes.
Okay, short-term goals are going to be some things like decreasing your pain. All right, so those are things that we want to do right away. We want to try to bring your pain level down. What would you say your pain level is today?
Probably about a 4 or 5.
Okay, 4 or 5. All right, what we'd like to do is get that in a manageable range for you, somewhere around a 1 or a 2,
okay,
if we can. Okay. Long-term wise, what we're looking at is we want to increase your core strength in your belly. Okay, we want to increase your strength in your back as well, obviously, and we want to work on some flexibility. Okay, does that sound like a plan?
Mm-hmm.
Okay, so the first exercise that we're going to talk about today is the pelvic tilt. Okay, so what I want you to do is just bring your legs up, feet flat on the floor, and what I want you to do is tighten the abdominals and at the same time push the back into the floor. Okay? You're going to do that and hold that position for about 5 seconds. Okay? And ideally, not for today, but when you do these at home, you're going to do them about 3 sets of 10. Okay? Does that make sense?
Yes.
Okay. After that, same kind of an advanced part of the pelvic tilt is the dead bug. Okay? The dead bug has several components to it. You're going to start out just like the pelvic tilt. We're going to push the back down into the floor, tighten those abs, and all I want you to do right now is bring the right leg up just about 4 to 5 inches off the floor. Okay?
Like that?
Yep. All right. Go ahead and relax. And now do that with the left. Okay, relax. Okay, now just with your right arm, straight up over your head. Okay, perfect. Nope, not with your leg just yet, just your arms. Okay, bring the arm down, and now go with your left arm. All right, good. Now we're going to go opposite arm, opposite leg. So now we're going to lift this one, and we're going to lift this one at the same time. All at the same time, keeping those abs engaged. All right, now do it with this side. Okay, perfect, good. Good job. Any questions on that? Any pain, anything bothering you?
Nope.
Okay, that's one of your red flags. If you have pain, you need to let me know so we can make some adjustments, okay? Okay, the next one, same position, is the gluteal stretch. Okay, so we call this kind of a figure 4 stretch. So what I want you to do is take this leg and put your ankle right here on top of your thigh. Okay, I want you to grasp the thigh, and I want you to pull that leg into your chest. Nope, lift it up. There you go. Just like that. Okay, you're going to get a nice stretch down in the gluteal muscle. Okay, and that should be feeling on this side. Is that where you feel a stretch? Okay, good. You're going to do that both sides. Okay, and while we're here, this is one down the line, but this is what we call a partial curl. Okay, kind of like a sit-up or a crunch. You know how to do those? All right, so again, feet flat on the floor. I want you to just tuck your chin into your chest and raise your chest up off the floor. There you go. Perfect. Now relax. Do another one. Chin into the chest and raise up. Perfect. Okay? With all these, we're going to start out with small reps and sets. Okay? We may start out 1 set of 10 of everything, but I'd like for you to progress up to like 3 sets of 10. Is that okay?
Mm-hmm.
All right. Now, After that, let's go ahead and put you in on your hands and knees. This is what we call a quadruped position, all right? And what we're gonna have you do here is, again, tighten those abs, and I want you to lift your right arm with your left leg straight back. Extend both of those, all right? Good. Now, do it with the other side. Nice, slow, and controlled, okay? Try to keep a flat back here. All right, good, perfect. All right, again, about a set of 10, progress to 3 sets of 10, okay? The last one that we have for you is what we call the side plank. So go ahead, let's put you on your right side. I want you to rest. I want your ankles, hips, and shoulders to be in a straight line. I want you to kind of brace yourself on your right elbow. There you go. Now I want you to bring the hip straight up towards the ceiling and hold that position. Okay, perfect. Okay, do one more for me to make sure you have it right. Again, what we're looking for is about a 15-second hold here, and ideally we'd like to get you up to where you can hold that for a little bit longer, as long as a minute, okay? But again, progression. In all these are progression. Use pain as your guide. If you're sore the next day, let's back you down. Maybe you don't do the exercises that particular day, okay? Any questions whatsoever? Okay, one more stretch here. The last one is you're gonna bring your double knees into your chest, okay? So bring those in, kind of a stretch, and just nice and slow and controlled, okay? Those are what we're able to we're gonna start you out with right now, all right? And then, like I said, I want you to try those about every other day, starting out, and then as you feel comfortable, we can progress you to a daily routine, and we can manipulate reps and sets, okay? Does that sound good? All right, any questions?
Nope.
Okay, what I want you to do is, if before you go out, make sure you schedule another appointment with me, okay? And they will have my business card up front. I'm gonna give you these, this program to take home with you, okay? And on the bottom there is my number and how to get a hold of me. And if you have any questions at any time, you can certainly contact me.
Okay.
Okay?
Yeah, thank you.
All right.